Good afternoon. This is Doug Farquhar. I direct government affairs for the National Environmental Health Association. For this month's edition of Advocacy Insights, we have a really special guest, Deb Houry, from who was formerly the chief medical officer at the CDC and now is the principal. She's running her own consulting firm, Leadership and Strategies, and she's also working as an adjunct at Yale and at Emory. So she is keeping quite busy since she has left CDC. But there's one issue we do want to talk with you today about that's probably at the top of our agenda, which is the West Coast Health Alliance. And what is that and what is it all about? But before we get too deep in here, I'd like to let you introduce yourself. Tell the audience who you are and what's important to you these days.
Okay. Super easy to answer in 30 seconds, right? But no, Deb Houry, great to be with you today. I've really appreciated working with you in my past roles when I was at CDC. I was a tenured faculty member at Emory, where I taught in the School of Public Health and School of Medicine and emergency physician by training, and then joined CDC back in 2014, where I led the Injury Center for about 7 years, and then was acting principal deputy director and then the chief medical officer at CDC, as well as the agency's transition lead over the past year. I stepped down from those roles and at the end of August, given some concerns I had around scientific integrity. And since then, I've stood up a consulting firm that you can find at debhoury.com. And I'm a senior fellow at Yale. I'm an adjunct prof at Emory. And one of my main consulting roles that I'm doing right now is working with the state of California on the West Coast Health Alliance, as well as looking at some of the technology integration, as well as how we can really have evidence-based practices really throughout the state and region.
So California is the main participant in there, but who else is involved in the West Coast Alliance?
So in the West Coast Health Alliance, this is done at the governor's office. There's 4 states. It's Hawaii, Washington, Oregon, and California. And that was formed about a year ago. And, they meet regularly to look at things around like some of the recent vaccine guidance that has come out, preparedness across the states, data sharing, governance, communication. There's other collaboratives like that, across the nation. The Northeast Collaborative has one that's more at the state health officer level. And, just to kind of pivot a bit on the West Coast Health Alliance, those are the 4 states that are in that alliance. But we recently received funding through the Robert Wood Johnson Foundation to have a convening this spring, where we will be bringing 10 to 12 Western states together, blue, red, and purple. And that will be different from the West Coast Health Alliance. My hope is to continue to bring that group together as a network or a collaborative after the end of March to really have a broader regional approach to health issues.
And will this be, are you looking at the governor's office, the state health directors?
That's more at the state health director level. I think, trying to be as apolitical and bipartisan as possible. And certainly, governors work across the nation together. And as I have talked about, there's a Western Governors group. But for this convening, at least, and for the collaborative, we're having at the state health officer level. But what I've said is they are welcome to bring, 1 to 2 additional people. So, whether it's a state EPI, whether it's environmental health, whether it's Medicaid, it's not for me to decide. It's for them to decide who is on their team for when we have some of these initial conversations so we can work across the region.
And what are going to be some of the big themes for this? What are you going to ask them to talk about?
So still working on that. I'm doing individual meetings with each state first because I want to have, those really kind of closed door conversations so that then when we have a bigger group, we can prioritize. But some of the things that are rising to the top right now are around data, navigating electronic health records, health information exchanges, some of the new technologies around AI, and how do you integrate that to really have much more actionable data. So that's one. And even as we've seen some of the concerns around data coming from CDC, what can states do Yale has Pop Hive. What are other data sets that states can look at and regions? So that's one. Second is probably around preparedness. We're hearing a lot around, how can states respond within their state, to local health threats. And I say health threats versus outbreaks because, as you and I know, like there's East Palestine where we had the train derailment, there's wildfires, there's certainly that. And we know also that that isn't restricted within the state, it's across regions. And so that's why we want to have a regional approach. I'm also hearing a lot around trust and communication. So there will likely be a session on that. Caitlin Jedalina has been part of the Governor Newsom's initiative in California around the Phoenix initiative that myself, Susan Menares, and I are a part of. And then the fourth area, not surprisingly, will probably be around vaccines or evidence-based guidance. That has come up a lot as we're seeing decreased vaccination rates in states, as well as guidance that's coming out of CDC that is not evidence-based from their vaccine committee. And how do you go through that? But then there's so many other topics that have come up, whether it be like global or environmental health or regulatory issues that I think we'll probably have small breakouts over lunches or different themes like that so that the different states can really work together. And this is a start. Like, this is not a convene and be done. In my mind, this is to get everybody together, have some working norms, set some initial priorities, form some work groups or some smaller groups of subject matter experts that can then work together. And there's, I think there's good examples of that. There's the Pacific Rim Laboratory Consortium that already includes multiple states across the West.
Right, right. And I'm very pleased to hear that Susan Menares is working with you. That's wonderful. You've got the top people in public health working on this initiative. This isn't the first time California has gone rogue, so to speak. I remember about 20 years ago, really dealing with the issue of toxics and chemicals and them not being satisfied what they're getting out of EPA, and the state legislature creating really an outstanding program, working with the lab to really move forward to get the data that they need. And really, it's a question of data. Once you get the data, then you can go ahead and figure out what you want to do with that. This isn't so much a group trying to dictate what should be done as let's gather the evidence and see if this is really going to meet our needs. Is that correct?
Yeah, this is really meant to be, collaborative, grounds up. And it has formed a lot, I think, not to replace CDC. I want to be very clear. It came from CDC. I think we need a federal public health agency. But, local states and regions have different needs and also the ability to innovate and do things differently. So I think this is the opportunity, to work across state boards, to work across local health departments, to really, focus on what are the needs and priorities of the community. And, you mentioned rogue. In my mind, it's not necessarily rogue versus leading the pack or innovating, like what California is doing with the World Health Organization. They are now part of the Global Outbreak and Alert Response Network. Other states are also now looking at doing that as well. But in my mind, it's just to have that situational awareness. It is the fourth largest economy in the world. And so, California, I think is leading the path, but is collaborative and is working with other states on this. It's about taking care of patients and populations.
Well, it'd be very interesting when we start talking about environmental health issues, because if you look at climate change, you look at issues nationwide, you're going to be talking about, pollution going in the air, disasters, whatnot. But if you look at the West, it changes the dynamic a little bit. Wildfires has been so prominent out there. Do you think there'll be an opportunity to really discuss and explore how these issues, these environmental issues, really impact the public?
So, if it's not at the first convening, I think over time it will. My goal is to have this be organic and driven, by the people in the room. But we know that, things like wildfires, heat and health all impact health. The work that was being done at CDC prior to my leaving around the heat tracker that they had, and some of the wildfire guidance, I thought was really helpful. I know that they work, a lot with, states and organizations such as y'all's, on it. And so I think certainly when you look at how environment impacts health, and even when you look at the changes in vectors, like the changes in Lyme disease and chikungunya and all that we're seeing because of the impacts of heat and health is really important.
Yeah, we're starting to see, creatures like
Yes.
scurryworms coming north. We're starting to see dengue
Yes.
come into this country. We're starting to get tropical diseases. But what you're going to see, and this is, I guess, my view is how you're going to see that play out in the West, Arizona, California, versus the Coast states is going to be dramatically different.
And that's the power, I think, of a regional approach because each region is going to have different regional health threats that they're dealing with. Doesn't mean that you still don't need a unifying, body at the federal level, but it's going to be different by region and state as well. And so this allows for that creativity, innovation, and more community responsiveness.
One of the programs that the CDC's National Center for Environmental Health had was a biomonitoring and tracking program, and really it was and is small in the sense that it only hits a few states at a time. But it does bring out data which we never seen before. And one of the more fascinating issues is what they call Four Corners Initiative, where they're dealing with tribal lands. And what are the actual health outcomes that are occurring, and then taking a reach back, like what is environmentally leading to that. And California was at the forefront of this for many years. They don't have funding any longer, but they did fantastic work at really being able to identify. Um, you know, your experience or your experiences, where does data play into this? How does the environment really play into the public's health?
I think when you look at things like data, it's making sure that you're whether it's tracking changes in humidity, temperature, how that plays, air quality, all of that, should be part of actionable data that can be used and understanding how it impacts health is really important. So I think as we're looking at how you integrate an electronic health record, immunization data, census level data, you certainly want to include the environmental factors as well.
One of the things I think CDC has always had the trouble with is collecting data, because generally to get this information, they kind of have to pay the states to give it to them. Otherwise, the states don't have the infrastructure there. Uh, Do you have any thoughts about how to combat that? How do we get the data so we can actually make a solid response?
Yeah, I think there certainly are issues when you look at, funding, appropriations, data privacy. But I think if you look even within states, there can be issues,
Yeah.
whether you're trying to get, different health systems, to share data, and that's where some of the health information exchanges I think are really helpful. So we have to look at that same model for public health. Is it using, a shared API or different things like that to exchange data? And AI is here, and so is how do we learn to utilize the technologies to benefit public health? And I think we're still very, nascent in those stages, but this is the opportunity, I think, with a lot of these initiatives to see where we can use AI and new technologies to help with data. It's certainly not going to be some of the standard, data we're used to, but it doesn't mean we can't utilize it to inform public health decisions.
Right, right. And it's going to be kind of tricky because California, very robust programs, they can collect data, get information. But the second you go to Nevada, you go to Idaho, those systems aren't in place. And so it's going to be a bigger challenge to kind of sense what is actually impacting there, what's going on in those states.
Well, I would say, I think each state, has unique strengths as well as growth areas. I've, seen how there's health information exchanges that are shared across states. And Utah has been doing some really innovative work around working with their health systems. And then Washington State has done some phenomenal work too when it comes to using public health data and information exchange. So my hope is that each state has different strengths that we can learn from and then leverage.
That'd be great if we can actually, this effort getting going business. I think You're correct. Almost regardless of what's happening nationally, there is a need for the Western states to discuss. And it's probably the same thing with the Northeastern states. Now, are you working with the Northeastern states directly, indirectly?
Yes and yes. And I literally had a call with them this morning. So, I there's several different, national organizations that are bringing these collaboratives together in more formalized fashions. But then at least once a month, about every other week, usually though, I touch base with the Northeast Collaborative leaders. So it's one of those things that we're really trying to ensure that, I'm learning from them about what they're doing around governance or work groups and vice versa. And so I think that's why I was always drawn to public health, because it's about, sharing information, not about
Mhm.
ownership, and about really where you can have the impact.
Yeah, and it'd be great if we could figure out, if they're doing something inventive up in
Exactly.
the Northeast, let's take it, and vice versa.
Exactly. There's absolutely no reason to recreate things. And even like within the vaccine landscape, CIDRAP and the Vaccine Integrity Project is doing such great evidence reviews, and Common Health Coalition looks at, how can you implement them in health systems? So in my mind, it's like when there's groups already doing that, the regional collaboratives can then look at how can we augment or, use that work that's already going on versus recreating it. So it's just being aware of the different efforts that are happening.
Right. And with you know, within our realm, within the environmental health realm, we got a really unique role to play with this because we're not dealing with, a disease base. We're dealing with the factors on the ground, what people eat, how they get their food, water systems, also wildfires, the air, what hits everything out there. And that gives kind of a different role. And it also means that we are, um, we're second only to nurses out there in the public health field, which, is one of those things that whenever when I first saw that, and that was from NACHO, that wasn't from us. NACHO looked at this and they said, yeah, environmental health is incredibly impactful out there. And if you throw in the disaster folks, preparedness people, it's almost reaches the numbers as nurses out there. So it's going to be hard to really do a uh, really improve the public's health without looking at this. CDC has the National Center for Environmental Health, and it has EasyID, which mostly looks at zoonotics and vector control and whatnot. What's your vision of environmental health? And not so much what you're going to do with the alliance as much as if you were omnipotent, what would you actually do out there to create a solid public health program?
You mean at CDC?
Well, let's start there
That's
and then let's leave. How do you even go beyond that?
Yeah, I think you have to look at all the interfaces, like you mentioned, like, water, air, soil. How does that impact human health? What are the impacts? And certainly, I think zoonotic is really important, as we've seen recently with avian flu, and you brought up, screwworm. So, where do those impacts happen? When I look at environmental health, what are the changes and what are the opportunities? Before I left, I know they were looking at things on microplastics, how do you detect them in humans? What is the actual impact on human health? There's still so much to be learned in that area. PFAS, there's been great studies that have been being conducted by CDC. I'd really like to see um, what are some of their findings, and they had developed clinician guidance last year. Still early in the stages, so I think really understanding what are some of the impacts of um, these environmental issues on human health, and then what is the differential impact within each state. And I don't think, at least in my mind, that it has been as strategic um, and as prioritized probably as it could be across states and regions. And surely that's, in part due to funding and things like that. But um, I've always thought it's really helpful to have a diverse group of sectors, disciplines, when you're looking at health. When I ran a center at Emory, I had political science and
Mhm.
sociology, nursing, all is part of it because everybody looks at things with a different lens. And so in my mind, when we're looking at health and the intersection with environmental health, You want to have, industrial engineers. You want to have chemists. You want to have a very wide range of experts as part of it. Otherwise, we look at it with one lens and we miss what's on that all around us.
Yeah, and I think you make a good point there. And of course, being a political science guy myself, it's it's very interesting because we've got so much effort going down on the health side, but then they say, well, why did Congress do this, or why did the state legislature do this? And it's because, well, they did you ever talk to them? They really don't know.
Yeah, and I think that's something I hope, you and your members continue to do, and that's to educate, communities as well as Congress on what are, the health impacts and what are these important programs. Um, in my time now that I'm not at CDC, I've been able to do a lot of congressional briefings and really talk about the importance of public health and programs. And we have to be careful in my mind, not to be too wonky. Like if you talk too much about like
Yeah.
policy or this or that, or, drill down to the data too much, is not as understandable. I think the more that you can translate it to what is the impact on communities, what are some stories you can share about, changes in food supply because of changes in heat, that I think, really resonates with congressional members. Like what is happening in their districts because of these changes?
Yeah, we had a discussion once in the Midwest with legislators about climate change, and they were ag legislators, which made it particularly tough. But when the CDC, it was George Luber who came in and spoke, the first thing they started saying was, "Well, we're going to be able to grow sugarcane in southern Illinois. Sugarcane gets this much an acre, and we'll be able to." It was. But you're right. People will look at this, whereas climate change is a disaster for some. There are others who are going to look at it from a whole different point of view, and it's something we do have to get across. The thing I get most, between what the medical community and the public health community looks at versus the policy maker community is a single issue versus the broad impact. And for a policymaker, they have to look at everything. And for the medical community, they can say, well, we got a problem here with lead hazard. We got a problem here with this one disease or this one. How do we address it? And, when you start dealing with one disease, then the other ones get worse, or you lose attention. You're not able to handle it all the way around. Will you be able to really kind of emphasize kind of the general broad areas that will be able to communicate back to not only Congress, but to the state legislators in the West about saying, you're seeing a rise in this area and these factors are contributing to it. But, you know, do we need to do one thing or we need to do many things? How do you want to, how would you frame something along those lines?
I hope so, but we're so early in the discussions, that I don't want to presuppose. I think, we have to really come together as a region, determine what the priorities are, what are the pressing health issues. I certainly have my thoughts, on what some of them are, but, we need to ensure that everybody's voice is heard.
Yeah, and here comes the other big tough issue. Yeah, politicians do have to hear everybody's voice and they got to respect everybody's voice and whatnot. And they got to make a decision. And what's going to work in Southern California may not work in Alaska, and it may not even work in Northern California. So, what are going to be some of the good universality? What are some of the good tools that we can use to help enlighten policymakers and help enlighten the community as to public health needs?
That's a tough one. I tell you, I think there's still a lot of good resources on the CDC's website, but that's why I paused. When you look at some of the information on things like autism and vaccines, I'm not recommending the CDC website anymore. I'm recommending groups like the American Academy of Pediatricians. I think you can look at within health departments, some of the work that's also being done as innovations. And I think, again, the more you can keep a focus locally or at the state level versus nationally, because there's such differences. And when you have something that works, and CDC through their heat and health program, as you'd mentioned, like with some of the tribal programs as well, had some really, I'd say, good case studies. And I think if you can talk about some of those, the applications to health, the return on investment, that's
Mhm.
important.
Yeah, and I think one of good examples, the NHANES surveys
Yes.
that go out. And, I heard complaints, issues with different chemicals that have PFAS in them and different policies, nothing wide ranging until NHANES started studying it. And they discovered what was in like 90% of the population out there, something like that, which really
NEHA
triggered
is
something.
such an important, data tool, surveillance system. I was surprised, when it had suffered, some of those reductions in force in October 10th. So I was glad to see, that being reversed because that's where you get the clinical data, on these different health issues and the impact of nutrition and environment on human health that no other system can do. And it didn't really make sense for a secretary who says he wants to make America healthy again to not be able to have that data to understand those impacts.
Yeah, and really gauging where we are. Are we
Exactly.
making America healthy again? And where are the anomalies out there?
Yeah.
And of course, the bad thing about NHANES is it gives you national data.
Yes.
It can't give you state by state data. It's not designed to.
Yeah.
You can't even pull that information out. You have to really do it yourself. And as far as I can tell, I've never seen a state step up and do an NHANES of their own.
Probably takes a lot of resources and, time and lab capacity.
Right, right. And it would be an interesting effort there. But hopefully that doesn't hinder you from moving forward in the West, because I'm sure there are things that NHANES is going to be able to enlighten you with, but things that they won't be able to help you out with.
And I view my role as really just a facilitator, and kind of the thought leader in the West, but it's everybody else that's doing, all the important work. I'm just looking at how I can bring it together and help lift it up.
So I'm going to ask you to put a new hat on.
Yep.
You're the back chief medical officer back at CDC. How could we have, how could the National Center for Environmental Health better impact the dialogue in your office, in the administrator's office?
You mean like if we're talking about that in today?
Well,
Are you?
honestly, for the past, it's never been a good, it's never really received a lot of attention at the administrator level. Usually we have an administrator who comes from the clinical side. They are a clinician, they see things in a certain way, and they look at environmental health as uh restaurants and rats. How do we improve our message?
Yeah, I would say a lot of it is really focusing on the link to human health and under, Dr. Cohen, when she was CDC director, heat and health was a priority, and it was an agency-wide priority. And so I do think, at CDC, NCEH, can be really important. And when you look at their role, like in the East Palestine response, NCEH and ATSDR were, so important. And particularly with ATSDR, when you have those regional offices, it allows them to already have boots on the ground. So um, some of it is just the size of the center and the budget, and CDC in general is focused on infectious disease threats. Um, more emphasis on that lately. I certainly came from a non-communicable disease health threat with my initial role at the injury center, so I very much appreciate the role of non-communicable health threats. But I think with NCEH, really focusing on continuing to work with EZID when you look at changes in, vector-borne diseases. Um, and then a lot of the tools. I really thought the heat tracking, and the app that they had was
Mhm.
really helpful. So continuing to translate things into usable apps or tools that the public can use to understand the impact of these changes on health.
Yeah, and I think it sounds like it's data. We got to get the information out there.
Data, but how do you then use it,
I-
to impact health? Because in my mind, if I just know something is going on, but there's nothing to do about it, then what do? So it's like if you're aware of changes in air quality, that are impacting health, what do you do to protect yourself and your family? That's what you need to ensure, is that you've got those tools. If you've seen that it's going to be extreme heat, also understand what extreme heat in Arizona might mean versus like Oklahoma. Those are going to have different impacts on people's health because of humidity, because of the heat index, and because houses may or may not have air conditioning, and people may or may not be used to those conditions. So it's going to have a differential impact on health. So being able to really provide that information and guidance as well.
You kind of emphasized a point that I hear from policymakers all the time. Don't bring me problems, bring me solutions.
Yes,
Because thank you for the problem, but now what do you want me to do about it?
exactly.
And it's like, gosh, I don't know. We know we have this issue out there, but how do we address it? We know we have hantavirus. We know we have, asbestos in Libby, Montana. But now what do we do about that? And that's always been the challenge, because, from the policymaker point of view, they feel as dumbfounded as you guys do. What do we do to solve this? And they end up just doing the best they can.
Yeah, I think the more solution focused, across sectors, so important, and again, putting my doc hat on, like I'm about action, so like, if people come to me with different issues, it's like, okay, so what do we do to fix it? And so I think it's, how do you support, patients and populations, and then the broader population?
Yeah, it was we had dialogue yesterday with Brown University, and they've got this initiative about indoor air quality. And to me, they missed the biggest point. So I led to a long email to say, you really want to make impact, you got to deal with the building codes, because the building codes are actually implemented out there. If you change the codes, it changes everything at the state level, and they're already enforced. You don't have to create something new. But if you try to come in with a new system, a brand new infrastructure, you're going to invest all your time creating the infrastructure, not utilizing what's already out there. And it's very interesting. My apologies. I'm supposed to be letting you talk, but I got to get on this tangent here. Indoor air quality is a non-regulated community. When you're in your private home, under the best of conditions, the government will not come in and tell you, you got to do this, this, if you want to, build a home, if you want to get a permit for their home, that's where they can intervene. But it was very interesting with so many building codes, it's dealing with the health of the building, not the health of the occupants. So they will deal with fire in the homes, but carbon monoxide, less so. Radon, they're not as, excited about. Compounds, chemicals in the products. It's and that's where my translation
Yes.
I try to get back to, which is, we do have infrastructures in place, and you may not like those infrastructures or whatever. They may not be a health focus, but that's where we get the continuity out there. And that's where I really try to get on our big return on investment. And that's one thing I guess what I was trying to get for you here is, environmental health, you get a great return on
Yes.
investment. And trying to get that communicated to people in Congress, to the state legislatures, to your local folks. That's, we do have solutions. We know how to get lead out of homes. We
Right.
know how to eliminate radon. We know these answers, but it's going to take an investment, even though it's much, much less. We know if you put toxics on trains, they're going to derail. 30% of all trains derail at some point. So you're going to have problems. We know how to solve that. Either, don't put them on rail, or figure out another way to transport it, or increase the transportation. So I'm hoping, I really, I'm a big advocate on environmental health is a great return on investment. So I'm excited to hear that the Alliance is not going to forget us when you move forward.
I think environmental health, certainly links with everything. And you mentioned lead. And I think as you look at like, how do you do lead remediation when you're looking at like, paint on homes or certainly, water pipes, in the systems. And using that opportunity, as you're working with homeowners or with communities to broaden, to other health impacts as well. I think that's where we need to work really closely together. Is we always stay siloed. I shouldn't say always, but it's often in public health or health, it's easy to be siloed on a single program, single topic. And I think
Right.
we have to work much more together with community health workers, extenders, all of that within these communities to really focus on how we can optimize health for all, across different disciplines.
Yeah, I'm going to give you the final word. What would you love to say to the environmental health audience of America about your new program and what you have learned over your years of being a clinician, being in charge of the injury center, being at the chief medical officer, and now the chief consultant to the Western Alliance?
Yeah, I
What are
just
some
want
of
to
the
say,
good news you can get?
yeah, I just want to say, thank you all for the work that you do. Your boots on the ground. And I know, when I was at CDC, I always took meetings with y'all, because I was excited to hear about the work that you were doing. And I think as we look at, different determinants of health, environment has such an important piece of that. That I'm heartened by continuing these discussions and looking at how we can look at, policy, people, all of that interplay when it comes with environmental health and human health.
That is a great closing comment. Deb, thank you very much. I can't tell you how much I appreciate chatting with you. It's always great to see you. Hey, you're going to knock it. I think it's going to be this Western Alliance is going to be a phenomenal issue that's necessary. And I'm so glad you're involved with it.
Thank you. My pleasure.
Okay, you take care.